Well, good morning, everybody, and welcome to the panel on innovative health. I was amazed by the panel on space that I just attended. I learned some stuff I've never learned before, and I'm hoping that you enjoy the innovative health panel just as much. I would like to acknowledge that I'm speaking to you on the lands of the Wurundjeri people of the Kulin Nation. This is unceded lands, and pay my respects to elders past, present and emerging, and welcome any Indigenous persons who have joined us either in person or online today. I'm Peter Revill, a senior medical scientist for Victorian Infectious Diseases Reference Laboratory at the Peter Doherty Institute of Infection and Immunity here in Melbourne. I'm a hepatitis B researcher, and I learned the importance of communication and collaboration in the field of infectious diseases a few years ago when, with some colleagues from Australia, Professor Stephen Loccanini, and from France, Professor Fabien Zulem at Lyon, we co-established the International Coalition to Eliminate Hepatitis B, which has brought researchers together from around the world, but not just researchers. We have engaged closely with the HBV-affected community to try and fast-track a cure for hepatitis B. We've learned a lot about another virus in the last couple of years, but hepatitis B is an ongoing pandemic that affects nearly 300 million people worldwide, and there's no cure. So through bringing together the global research and HBV-affected community, we're trying to fast-track a cure. So that's where I that's where I fit into today's equation. I'm delighted to chair this panel. The COVID-19 pandemic has presented human health challenges in a scale not encountered in, I could be safe in saying in this room, I think in all of our living memories. In turn, the warmer temperatures and changing weather patterns associated with climate change are affecting disease spread and equitable access to enough food and water to sustain life globally. Our innovative panel of world health experts in infectious diseases, diagnosis and management, disease modelling, new technologies, education and mental health and the agricultural sciences will provide insight into the current problems facing the global community in these settings and discuss innovative approaches to address these ongoing challenges. We have an amazing panel, and I'll introduce them now and ask them to come to sit please up on the stage. Professor Deborah Williamson is a clinician scientist and director of the Victorian Infectious Diseases Reference Laboratory, professor of public health microbiology at the Doherty Institute, University of Melbourne, and a laboratory head at the Walter and Eliza Hall Institute. She received a L'Oreal UNESCO Women in Science Fellowship in 2017 and was awarded the 2020 Frank Fenner Award for Research by the Australian Society for Infectious Diseases. She is an NHMRC Investigator Grant Fellow, and her translational research group at the Doherty Institute focuses on the development and application of diagnostic technologies, including genomics, to infectious diseases. Her research has directly influenced the way microbiology is applied to clinical practice in public health, including responses to antimicrobial resistance and COVID-19. Please join me in welcoming Professor Williamson to the panel. Professor Rachael McDonald is the director of the MedTech Vic Hub and the program lead in chronic disease and disability at the Iverson Health Innovation Research Institute at Swinburne, here at the Swinburne University here in Melbourne. She is a clinical research and teaching health professional with qualifications in occupational therapy and biomechanics. Rachael's passion is to create supports that enable people with lifelong disabilities to participate in life situations. Please join me in welcoming Rachael to the panel. Dr. Romain Ragonnet is researcher in infectious disease epidemiology and modelling. He uses his unique expertise at the intercept between mathematics, epidemiology and computer science to create mathematical models of disease transmission. A significant part of Romain's research consists in exploring the dynamics of Mycobacterium tuberculosis transmission in order to improve the understanding of TB epidemiology and to assist local and global TB control. His research has contributed to guiding the public health response in the field of tuberculosis epidemiology and during the COVID-19 pandemic. Let's welcome Romain to the stage. And Dr. Jean-François Hocquette is Outstanding Class Research Director working at the Herbivore Research Unit of INRAE, the French National Research Institute for Agriculture, Food and Environment. His research interests concern muscle biology as relevant to muscle growth or beef eating quality. He was leader of the research team Muscle Growth and Metabolism from till 2006 and director of the Herbivore Research Unit until 2010. He has been working for the French High Council for Evaluation of Research in Higher Education from 2012 to 2021, and he is now president of the French Association for Animal Production and scientific officer in charge of International Relationships for Australia and New Zealand of INRAE. He will organise the World Congress of Animal Science in Lyon in 2023. Let's welcome Jean-François to the podium. So we're going to examine, our panel is going to examine the issues that I've talked about through a public health, One Health, mental health, and educational lenses. And I'll join the panel now over here. I'll pop myself down in the middle. And first of all, we're going to have a slide presentation, I think, from Jean-François. Thank you. We're going to have a slide presentation, a few slides from Jean-François first.
Thanks very much for this kind invitation. I would like here to present the PREZODE initiatives, which is an international initiative, and PREZODE means preventing zoonotic disease emergence. So, as you know, there are many outbreaks during the last 2 decades, and these outbreaks appeared in all continents, and no country is protected. And as you know, zoonosis are disease transmitted from animals to humans, and they are very, very important. So this international initiative, the PREZODE, was launched to work with countries and with other initiatives for avoiding animal-borne pandemics while ensuring food security and livelihoods for the poorest communities. So we will address sustainable goal number 3, but also a significant number of other sustainable goals. So this initiative is based on a new paradigm towards prevention and bottom-up approaches. So the focus is really prevention. So we want to work on risk assessment, risk reduction, early warning systems, and livestock and ecosystem management. And we want also to be prepared by developing tools for pathogen detection and local to global surveillance systems to avoid transmissions of disease to human beings. So our aims in practice are based on 4 pillars. The first one is to build a reference framework for preventing emerging risk. The second one is to build a collaborating platform for sharing knowledge and synergic activities. We would like to develop a support mechanism for research and development for research programs and research projects. And finally, we wish a strong international collaboration to facilitate decision-making and relevant public policies. So where are we now? So this initiative was launched at the One Planet Summit. It's supported by many institutions and many organizations, many countries, and it has already some funding. So it's a network of different organizations together. And on this map, you can see all the countries which joined these initiatives and all the partners. And these partners are mainly academic and research groups and also governments. So this initiative is organized into 5 pillars. So the first pillar is really focused on identifying and understanding risk. The second pillar is focused on risk reduction. And the third pillar is focused on early detection and rapid response, considering socio-economic constraints. And the fourth pillar is to scale up emerging risk surveillance systems. And in pillar 5, we want to engage local and national stakeholders to strengthen the One Health network. So since we launched this initiative, we organize many workshops, And the first General Assembly of this initiative was organized recently. And we are organized in 4 working groups about governance, science, partnerships, and communication. And there is an open position for the PREZODE General Manager. So to conclude, this is a common framework to foster collaboration and impact by building collaborations with other partners, by securing the required level of funding, and by building up joint programs. And if you want to join this initiative as an organization, please go to the website and you can sign a letter of intent. Thanks very much.
Thank you very much, Jean-François, and that sets the scene very, very well. What we're going to do now is have a fairly informal discussion, and I'm going to ask a series of topics and questions to each of our panelists. And there's such a broad range of expertise here. I'm going to ask that Professor Williamson answers the questions from a public health and infectious disease perspective. Dr. Ragonnet answers the questions from an epidemiological and mathematical modelling perspective. Dr. Hocquette answers from a One Health and agricultural science perspective. And Associate Professor McDonald answers from a medical devices, mental health and educational perspective. So we're going to have a whole lot of different thinkings and approaches here to answer these really important, what I think are really important questions. So the first question that we're going to ask each of our panelists is, what are the greatest threats to human, agricultural and mental health associated with changes in climate and disease spread? And I'll direct the first question to Professor Williamson.
Thank you, Peter. Yeah, it's I guess a sobering question. And, you know, when I thought about this question, I couldn't help but think of, I guess, the 4 horsemen of the apocalypse: plague, war, famine, and death. It's I'm sorry, it's not very positive, but it sort of feels like that in a way. That's what we're living through at the moment. You know, we've got the pandemic, we've got war in Europe again, you know, we've got famine ravaging parts of the world. And, you know, for me, a lot of the drivers of, you know, climate change and disease spread, they're geopolitical drivers. I can't help but think that we need, I guess, a paradigm shift in the way that we approach these things, from what is almost, you know, purely reactive at the moment to preventative, you know, long-term thinking. And I'm not sure that many of our leaders at the moment, certainly the way the political system is structured, does not lend itself well to that long-term thinking. So for me, and I guess you asked me to, that's, I guess, a broad outline, but specifically from a public health and infectious diseases perspective, we're not taking the threat of climate change seriously enough when it comes to emerging infectious diseases. And, you know, we had the emergence of in addition, I have to say, to SARS-CoV-2 and its variants this year, we had the emergence of 2 other infectious diseases, one in Australia and one globally. The first one was Japanese encephalitis, which emerged in Southeast Australia at the turn of this year. Never thought to be endemic in Southeast Australia, but it emerged. And that it emerged on somewhere where you could think of as the climate frontier in Australia, which is, you know, the Murray River. And that is a place, you know, that is highly prone, obviously, to droughts and floods, so cyclical floods and droughts. And so that's right at the, I guess, at the cutting edge of climate change in Australia. And it's no coincidence that a mosquito transmitted disease emerged there. And that should be a massive wake-up call to us here in Australia, but globally, in that these diseases can emerge anywhere. The other one was monkeypox. So you have a zoonotic disease which got into, I guess, a very successful transmission network, and, you know, within months it spread never known to be endemic outside of West and Central Africa, spread and is now likely endemic in many, many countries around the world. These things, it's hard not to be kind of, I guess, desensitized to them in the wake of the COVID pandemic. But these are massive wake-up calls for humanity.
Thank you, Deb. I mean, yeah, here we are in 2022 in a world war, not in a war in Europe, and the flooding that we've just seen in the Murray River. There's going to be millions of mosquitoes in different areas of Australia. So, thank you, very great perspective. Please, Romain.
Yeah, I just wanted to make a follow-up comment on what Deborah was explaining, and especially from a vector-borne disease perspective. So when we do modeling, we are able to look at scenarios such as what would happen if, and one of these scenarios that we are looking at the moment is related to climate change. And when it comes to vector-borne diseases and mosquitoes in particular, what we actually find from the modeling is just a tiny little change in terms of temperature, in terms of rainfall, can have massive consequences in terms of infectious diseases. And we're talking about the Japanese disease, we're talking about the dengue, talking about malaria, all of these mosquito-borne diseases, they are all extremely sensitive to climate change. So I think that's a really important message that highlights the importance of collaboration between these different fields. So climate, weather, infectious disease, modeling, and also, yeah, just reinforces that we are not going to solve health issues by just looking at medicine alone. We just have to have this more like multifactorial approach. Yeah, so that's right.
Hi. So that's really interesting. I really like, Deb, your thought about saying that the issues with climate change, there's a couple of wake-up calls. I actually think that probably applies across the board, really. And in terms of the sort of consequences, I really wanted to go back to thinking about vulnerable populations, because one of the the populations, the types of people who have been really affected disproportionately are the people who are vulnerable. If we're thinking about, I don't know if any of you are trying to get in to visit relatives in nursing homes, it's really difficult. Anyone who has an acute disease in hospital, even at end of life, you can have 2 visitors a day. And what we're actually sort of seeing, and this is an indirect kind of cause, is that the effects of climate change are on the lack of human connection. We've had a lack of human connection in Victoria due to various things, but we're still having it for those vulnerable populations. And we can all become vulnerable because of the diseases that we've got. You get some of these diseases, some of the consequences that you become disabled, you have a disability, or you have a long-term health condition that makes you more vulnerable. People are also therefore scared. If you're scared of going out, if you stay in your home, you've lost your human connection, you've lost your quality of life. So I guess one of the things that, and then there are some very practical things from a kind of technology perspective. One of the things that happened a couple of years ago was the big power outages in South Australia. I don't know if people experienced those. One of the things that happened with vulnerable populations, for example, was that people who live on ventilators were unable to actually get their electricity, and the generators started running out. So if you think about the mental health effects of slowly losing your oxygen and not knowing when it will come back on, those are some of the sort of fairly dire consequences, I guess, that are that are not necessarily obvious, but are affecting all of us in one way or another. And so we're actually changing our society to actually be a crueler one. And that's one of the things that we really need to start addressing.
Thank you, Rachel. Jean-François.
So I agree that the greatest threat is climate change, because due to global warming, for instance, mosquitoes may colonize beyond the current habits, and shifting the burden of disease. So it's a main problem, and temperature controls several factors that underline times it takes for a virus to be transmitted to human beings. So global warming can also affect bird migration and the distribution of various virus in different areas. And these things are difficult to predict. They are really unpredictable. So we need some modeling approaches, as you said before, to predict these things. So it's a great challenge indeed.
Thank you. I think we can learn from the space technology session that we had earlier that I learned before that people at Ferrari, I missed the sessions yesterday, but people at Ferrari are working with heart transplant doctors. I mean, we need that sort of out of the box thinking of different people working together. You'd never think work together before. So now we're going to look at what we can do about it. So what key innovations will or would significantly alleviate these threats? So we'll go in the same order for each of our questions. So Deb, please.
Yeah, thanks, Peter. And I guess there's no one magic bullet right here. I think we can all agree on that. And actually, you know, the larger structural changes that are needed, they require those kind of large multilateral approaches. But again, I'll just talk to the specific area. And I think it is important to reflect on some of the, I guess, the silver linings, if you like. I hate to use that term because it's a bit trite, but you know, there were some positive things that came out of the pandemic in the innovation space. In fact, there were a lot. So for me, the three key innovations that I think have or should transform the way that we approach infectious diseases moving forward is vaccine. Of course, is vaccine development. That was unprecedented. So the development of actually several vaccines in such an accelerated speed, safe, effective vaccines, that should give us hope for other infectious diseases, and we should absolutely harness that moving forward. The other one, which again is commonplace now, but if you think about 2.5 years ago, we weren't using it. Self-testing for infectious diseases, self-testing for SARS-CoV-2. I will bet that almost everybody in this room has done a rapid antigen test for COVID-19. But 2.5 years ago, that was illegal. It was actually prohibited to do that. So it's not perfect, and there's still a lot of issues around access and affordability of these tests, but that goes a long way to democratizing, I guess, testing for infectious diseases and giving people agency over their response to, to having an infection. And if you provide clear messaging about what to do if you have an infection, then by and large, people will respond to that. So that's number two. And finally, the development of telehealth, remote provision of healthcare. And if you link that into self-testing for infectious diseases, then you've entirely transformed, the way that we deliver large parts of healthcare. So for me, they are the three innovations I think that are kind of flagships in infectious diseases. Thanks, Peter.
Romain.
Thank you. Yeah, I think that there are probably two main points I would like to make about this. So one thing is about education. I think if you actually focus on having better education and prevention and having people to understand, getting people to understand what a disease is and what an infectious disease is, that's already a great step forward, and that's already helping the control of the disease. And I think if you take the example of COVID-19, the population has learned so much during these 2 or 3 years about how to deal with infectious diseases, how to prevent transmission. And if you have this knowledge earlier in the pandemic, maybe this can actually improve the outcome as well. So I would say education, we should never forget. It's such a key basis for more than disease control, but I think for disease control, it's particularly important. The other point I wanted to make in terms of innovation is, once again, the power, the potential of collaboration. And I just wanted to illustrate this point with an example, very concrete example from my personal experience. So when we develop these mathematical models to capture infectious diseases, and especially with COVID-19, which is such a complex disease, and there is so much data available now to actually inform these models, which means, and that's actually a good thing, but this means that the models that we are using are getting so complex, it is actually getting hard to work with. And this requires the expertise of other fields in order to be able to use these models and in order to make these models informative. So I have been collaborating with people from France, from the CNRS in France, from the INRAE Institute, who are experts in optimization, in mathematical optimization and numerical calculations. They have nothing to do with health. They have nothing to do with infectious diseases, but their job is to take a complex optimization problem and to solve it. And our job in this collaboration was to provide this problem. So this had actually major advantages for both teams. So from our perspective, we have been able to use more complex, which means more realistic models because of their methods. And then from their perspectives, they had these novel methods. They were actually based on artificial intelligence for optimization. They had been testing these methods on what they call benchmark problems, which are kind of virtual problems that we already know the solution of these problems. So there is no real interest in solving these problems, but it's just about testing the algorithms. But what they really wanted to do is actually testing these algorithms on real life, real world problems. And actually we had a real world problem. So we actually combined these two expertise, these two types of expertise. And we've actually published 2 papers together. And one paper was on the optimization, like very technical mathematical aspects of optimization, using our models as an illustration of how well these methods perform. And another paper was an epidemiological paper, looking at a very specific public health question. And we had to use their methods to actually be able to answer these questions. So it's just an example of how collaborative innovation can actually drive progress in public health in particular. Rachel.
Hi, I wanted to pick up on your point about collaboration, because I think that has been one of the things. And I know Deb mentioned telehealth being one of the great innovations, and I had written down a very similar thing, but I'd actually put in a mechanism of digital communication, that we now digitally communicate in a much better, much more efficient way. And with sort of telehealth, it's not just a single clinician and a single patient. We actually have different mechanisms for collaboration between health teams that make things much more efficient. And that's one of the things that is really important in terms of innovation, given the increasing needs that we all have. I guess, so that was digital communication, but digital communication is also based on a whole lot of other things that we actually need to innovate for. For example, the example I used before with the power outages, one of the innovations that we know that we have and that we need is actually really secure and accessible and clean power, different battery types to support all of our industries. And that's the sort of innovative technologies that we have. And based on that then is a kind of a secure, sort of affordable, reliable and available internet connection, for example, so that you can have your digital communication, so that you can have your international collaborations. And that's something that we know we need. We don't have actually, so we don't do so well in Australia, but all of those sort of innovations will make a really big difference to us addressing the issues in the future.
Thank you. Jean-François.
I would suggest maybe 5 innovations in different domains. And the first domain might be techniques and new devices for early detection. So we should improve non-targeted detection of virus and pathogens and their variants at low concentrations in complex biological samples. So we probably need to work on new pocket devices and new approaches, such as metagenomics, to detect virus and pathogens in complex samples. And another innovation, of course, is related to modeling. And modeling is very important to predict the dynamic of the pathogen across different ecosystems. And in different regions. So we need to predict how the virus will be disseminated in specific regions according to temperature, climate change, and so on. Once we have a pandemic, of course, we have to develop new therapeutics with probably a broader spectrum for curation of these pandemics. And finally, not finally, but in addition to that, we should also work on more resilient and sustainable ecosystems to prevent any new pandemics. And this is probably very complex because it requires collaboration between different scientific fields in animal science, in veterinary science, in anything related to ecosystems. And so the last point, which is very important, and it was said before, is communication between scientists and stakeholders. So we need a powerful information system to collect the data and to use this data. And we are promoting the open science concept with the idea to use the FAIR concept to share data. FAIR means that data should be fundable, accessible, interoperable, and reusable. And this is a major frontiers in science, in health science, of course, but in any biological science, to share the data in a powerful information system with the different academics working together.
Thank
Thanks.
you, Jean-François. I'm so glad you said that, because we're now going to talk about the challenges. What are the challenges to implementing these innovations? And I was sitting here thinking, well, I think data sharing is one of the biggest challenges that we have. And we've seen that through the COVID-19 pandemic at the coalface. And we, in the previous session on space innovation, we saw exciting data sharing that's going on and will take place. The other challenge I see too, is something I've been thinking about sustainable planet, is the sheer generation of medical waste that we're generating that's not recyclable, that's just being dumped into landfill, particularly in low and middle income countries. The technology is extremely important for point of care testing and all of that, but the cartridges that are generated and being used, sometimes they're toxic and they're being dumped. They have to be incinerated at high temperature to dispose of them. A lot of countries mightn't have those facilities. So we need to use and rapidly develop these technologies, but it's happening so quickly. We're not thinking of the end user and the problems that are coming with that. So that's just a couple of my thoughts. So now we'll talk about the challenges in more depth. So Deb, please.
Yeah, thanks, Peter. That's an excellent point. And it's almost like every new innovation and technology should come with a checklist. Who does it benefit? Who will fund it? What are the long-term impacts on the environment? These are, and that sort of myopic, short-sighted approach to public health, to infectious diseases, I think is one of the challenges actually to implementing, some of the things that we are talking about, because we recognize them as long-term problems, but our politicians, our structures are designed to be short-term election cycles, short-term funding. So for me, that is a major structural challenge to implementing any kind of long-term sustainable change to deal with, the problems facing humanity. Data sharing is, there are some very obvious structural challenges to implementing that, in terms of legislation. And I'm hopeful, ever hopeful that, for example, the new Australian CDC will help tackle some of these challenges related to data sharing. But data sharing is not data sharing between jurisdictions in Australia is clearly not just the problem. It's data sharing across different sectors, and it's data sharing across different countries as well. And we definitely need a new way of dealing with that. I guess one of the other challenges to implementing a lot of the approaches that we're talking about is health messaging and disinformation. And for me, that was one of the a real eye-opener during the pandemic. You know, we've got these ways of digitally communicating with each other now, and they can be used and harnessed for so much good. But I think that we saw the flip side of that in the pandemic as well. We saw a huge amount of toxic messaging, disinformation during the pandemic. And I don't think that we were prepared for that at all. I don't think as public health practitioners, politicians, and I have to say the platforms that host these, that host these social messaging behemoths, they certainly weren't prepared for it. And what it seems like is that they're not prepared to deal with it, and that needs to change, because we need people to have trusted, evidence-based information. So I think that is a challenge that needs to be dealt with. And finally, another challenge is from a research perspective. I think that the systems and the structure and the funding that surrounds research is a challenge to collaboration and driving positive outcomes. And again, there needs to be some really sharp and sober self-reflection, I think, on what are research funding systems, because that's what drives innovation, right? What that looks like in a pandemic or in an emergency, but also in peacetime as well. So that's for me.
I think it's a really important point. It's just not a matter of throwing a big bucket of money at something. It has to be targeted and directed and peer reviewed and all of that sort of thing. So
absolutely. And I think that collaboration as part of that research should be mandated.
Yeah, no, terrific points. Thank you, Romain.
Yeah, I just wanted to come back to the point Deborah just made about messaging during the pandemic, for example, and because I found it particularly difficult to work on COVID-19 in such a polarized and political climate. And I think that there are definitely things that we can do to try to improve on this and try to avoid this kind of issue in the future. And one challenge about this is maybe transparency, I would say. When we have governments making decisions and the public doesn't know necessarily where these decisions come from, or they don't understand exactly why we made those decisions and not another decision, I think this is definitely a barrier. This is definitely going against people being compliant, and this is going to feed and going to promote this polarization that we've observed. And I think there are ways to do it. And I can tell you from my personal experience, I've been part of what has been referred to as public health advice to the government. And, I've been providing modeling projections to multiple types of governments. And what's interesting to see is I know exactly what's going on in terms of the technical aspects, the models, and the prediction that we have provided to the governments. And then when you look at the press conference, when a government will actually announce some restrictions or some changes to the policy, and they say that what they say only is we are following public health advice, but they are not really specific about what that means. And even I don't know what they mean, because I'm just part of this public health advice. And of course, they don't take decisions only based on infectious disease modeling. They have other expertise types that are involved, but no one actually really know what's going on, and no one really know the real arguments for making this decision versus another one. So I think a little bit more of transparency would help. This is challenging, and I guess this has to come from governments first. It's not a problem about academics. I would think it's mostly about the government. But definitely that is a lesson to learn from the pandemic. Another challenge I wanted to mention is complexity, because I guess we live in a world which is getting more and more complex in the way we live, in the way we interact with each other. And when it comes to infectious diseases, of course, this has some major implications, because infectious diseases are transmitted through interactions between persons. So for my job in particular, when I need to create a model that will simulate a disease, The main difficulty is about simulating the population and simulating people that will and how they interact together. Of course, on the top of this, we have to capture the pathogen and the disease-specific characteristics. But to be honest, this is not the most challenging thing. The most challenging aspect is how do we capture realistic interactions between people, how people move around. And we've seen with the pandemic, this is absolutely critical because if you look at the pace at which the virus has traveled and originated from China and then went all across all countries in the world, this is telling you that, yeah, the way people are connected, this drives the spread of the epidemic. And if we don't understand this accurately, there is no way we are going to model this and to simulate this and to provide accurate advice. So that means we have to keep up with this complexity, which means using more complex methods as well. And again, I come back to this previous point I made, collaboration is key. That means you require expertise from outside of your own field. I would not have been able to work with complex models if I had not collaborated with these optimization experts from France. And maybe tomorrow I will actually need another type of expertise and I will have to actually ask someone else. And I think that's the one thing that we have to keep in mind. The world is getting more complex. We need more complex methods, more advanced technologies. You have to reach out and ask for help from other groups and other fields.
The world's getting more complex, but I guess it's getting smaller too. So we can reach out and do that data sharing. So Rachel, your thoughts?
I was actually just picking up on a number of things that all three people have talked about, and that is partly around complexity, partly around systems and funding, and partly about kind of the way that we develop our technologies, the way that we develop our pharmaceuticals, for example. And just giving the example of the rat test, which we've already used today, and the plastic that Peter, you mentioned. Now that was a reaction, and we have a fantastic self-diagnostic tool that gives people agency. But the plastic on which we use, which was developed very quickly, is actually extremely toxic. Now there are very easy ways that we can use materials that are recyclable, that are or are disposable, or have a sort of circular economy that we could have done. Now that's great. We can still do it, but there is no longer the funding to do that development. There's no longer the research funding or the manufacturing funding, and there's no discussion between the manufacturers and the researchers and the scientists in terms of implementation. One of the other things that kind of it made me think about in terms of complexity and the idea around the social disinformation is fear. And implementation, some of the challenges to implementation is fear. We have, for example, in our health system, at source, an extremely risk-averse system. Now, in a very acute an emergency sort of situation, that's great. But implementation of new products, of new services, is actually really difficult to get into something that is risk-averse. It's risk-averse for very good reasons. I don't want anyone experimenting me when I'm under the knife. But there's all sorts of, but that risk aversion actually applies to everything. And the risks when you're actually in an operating theatre are actually very different to when you're seeing the district nurse at home. So we actually have real kind of issues with how we apply risk across our health service. And I think that kind of goes then into people in our manufacturing sectors are a little bit scared also of, and that kind of fear of getting into this area of technologies, of development, etc., because of the regulations and the disinformation, which goes back to that transparency. That there is, there's actually, it's not as difficult. I went to a talk last week at the Australian Assistive Technology conference by an engineer who has done a beautiful breakdown of TGA compliance. And that TGA compliance, he did this most simple thing. And I thought, why can't everybody do that? And why is this not published everywhere so that we can all understand that? And I think the other thing that we really need to kind of recommend, if we're actually thinking about the challenges to these innovations, are the skills requirements we don't necessarily have people with the skills to implement the innovations. And when we're developing our innovations, we need to think about how people are going to get those skills at an educational level, at a development level, and at all of those other kinds of things, so that the disinformation and the complexity is broken down.
Jean-François.
I do agree with the word complexity, and the science is more and more complex, even for data sharing. And to come back to this point, the first step in data sharing is ontology. I mean, how to define the traits and the variables we are studying. And it looks simple, but it's very complex. And it's a prerequisite to compare data. So we have started a huge program called Animal Trait Ontology of Livestock in France to define all livestock traits, not only in health, but also in production, in nutrition, and whatever. So this is the first step in data sharing, which is already complex. So the biological world is also complex, so it's more and more difficult to predict the future. So the one big challenge is that we don't know which pathogen will be responsible for the next pandemic. And so we don't know also when it will emerge. So it's a great uncertainty, and this makes the story very complex. So we have to develop more generic tools for early detections or of any type of virus and pathogens. So portable sequencing devices, for instance, for RP detection. And we have also to develop more and more complex modeling approaches to understand how pathogens and virus circulate and where they will go and so on.
Thank you. I'm conscious of time. We've only got a few minutes left before we're going to take some questions, I think, online. But I want to end the panel discussion on a positive note. I'm an optimist, and we've heard about the challenges and all that. But I guess what's been done really well, we've heard about some of these things, but let's expand a little bit on what's been done really, really well in the response to the pandemic and our response to other diseases from an agricultural perspective as well. So Deb, perhaps some reflections on that.
Yeah, thanks, Peter. I just very briefly, I just want to pick up on Rachel's point that she made about, you know, having people with the education and skills to deliver some of the innovations. I actually think that is a very critical point. And I was having a discussion, I hope you don't mind me calling you out, Peter, but with Peter Tolley in the tea break about what our education system needs to look like, you know, in order for that to happen. And we need places like Swinburne, you know, we need places like that where people can learn those skills, because at the moment our education system I feel is very rigid, you know. So that's one thing. What did we do well? Well, from a very big picture, when we were up against the wall, humanity came together. By and large, people did the right thing. You know, they followed the public health advice. People lined up to get vaccines. They were distributed. It was not perfect and highly inequitable, I have to say. But by and large, you know, we came together when it mattered. And I think we should draw hope from that.
Right.
Yeah, I would say very broadly, I was just so impressed that we came up with vaccines after just, was it 12 months in the pandemic? I mean, vaccines that have been tested and ready to use after 12 months. I think that's something that's absolutely fantastic. And I guess this has been possible through collaborations between, you know, private and public entities. It was not pharmaceutical companies working on their own. It was not just universities working alone. It was just everyone working together, along with people monitoring the disease and providing data on how the disease characteristics and all of these aspects. So I think that was quite impressive, and I don't think you can do much better than that. So that was fantastic. And just coming back to the previous answer about people, you know, the humanity responding to this threat and coming together, I would still I'm sorry, I'm not very positive about it, but I would still say that I would much prefer to see this happening without people being forced to do things. And, you know, because we've been addressing a public health issue using police and even sometimes the army to go and knock at people's doors. And I don't think that's okay. And the problem is that we actually had to do it. And the reason why we had to do it is maybe people were not ready to handle this pandemic. And so what I would really like to see is exactly what you've described, but people doing this from their own will. And again, this is coming back to education. This is coming back to trust in governments, you know, because unfortunately it was not enough for governments to provide recommendations. They actually had to enforce, they had to mandate masks, they had to mandate vaccines. And I personally think that's not how a public health issue should be dealt with. But the observation is that the population was not ready for another alternative. So I think I'm maybe a little bit less positive than you about this, but I guess it's also among the lessons to learn for the future. Yeah.
Thank you. Rachel.
I'm going to say very similarly, pivoting was one of the things that we did very well. And pivoting meant that we could, for example, and again, kind of halfway in between in terms of humanity and then feeling a bit cynical, you know, lots of people were able to keep their jobs through hybrid working. Now, obviously that's white collar workers. So there is a kind of downside to that. And I think that, but it also means that some people were actually more included. We collect data with people who have disabilities, for example, and we can do that online and they prefer it. And it's actually easier for us to reach those populations. So there's all sorts of things. I think the other thing that we have to also say in Victoria is we were able to keep our numbers down until there was a vaccine. And that was really a success. And the final thing was we were able to pivot our manufacturing sectors to do what they needed to do. Now, as we heard in the last bit, there are some things that we need to do now, but there were some really positive outcomes that we can build on with the right will and support.
Rachel, Jean-François.
So briefly, in addition to vaccines, we think that understanding the virus pathology help reducing the hospitalization period of people, and also it increases the success recovery rate of patients in hospitals. So it was really positive, I think.
Thank you. Thank you. And thank you very much, panel. I think now we've got a few minutes for some questions. Okay, so questions from the audience and some questions, I think online. We have some online, Paul, but we'll take some from the audience first. So please.
Hi, thanks very much. Excuse me for the interesting discussion. Just want to trying to, I guess, bring things back to the previous panel as well.
Just introduce yourself first.
Oh, sorry, I'm Steve Petrie. I'm with the Space Tech Institute at Swinburne.
Perfect.
Yeah, just wondering about what sort of satellite observation data is coming into the detection of emerging infectious disease. I've heard that they're becoming more likely with human encroachment on wild spaces and interaction between domesticated and wild animals and things like that. And yeah, just wondering about that, both from the modeling perspective and from the initiative that you, Jean-François was talking about before as well.
If I understood well, you're asking about observations to better predict. Yes, we need not only biological indicators, but also indicators related to the social economic context, to indicators related to climate change, to livestock management, to land use, and so on, and to combine all these indicators together to predict how the virus pathogens will be disseminated in a specific context, in a specific region. So it's really a combination of indicators.
Yeah, I might give a specific example of how observations might be useful. So in mathematical models that try to predict disease spread for mosquito-borne diseases, there are some factors that are very important that could be actually addressed by Earth observations. And this includes the location of water, like rivers, what's the exact location of rivers, and also like just even ponds, like sometimes even tiny ponds can have a dramatic impact on transmission for mosquito-borne diseases. So I guess if you have a higher level of resolution for these observations, of course, you can improve your predictions. So this is just an example from a modeling perspective.
I was thinking that during the space technology session earlier, how can we use all of that? Or maybe we are, I'm not aware of it, but we should be using all of that observational technology to map disease outbreaks as well as bushfires, as well as floods. So I think it's really important. We've heard a lot about collaboration, that we all work together. I think some discussion should come from these sessions today even. So I think we had another question. Did I see it?
Yes. Good morning. I'm Jean-Paul Toutin from CNRS representative office. We are talking about very swiftly getting infectious disease, new infectious disease. An area of evidence, great concern is Southeast Asia. So far, I didn't hear you talking about cooperation for development training with countries which are clearly lacking expertise and competencies. France has already a given network with the Pasteur Institute, CIRAD organization. And my question is, Australia is one of the main powers in the area. And do you have expectations to work in this direction?
Fantastic question, and I'll hand it to Deb first, but just to say that one of my roles also at the Doherty Institute and at VIDRL is a head of global and regional health, and we're working closely with Institute Pasteur, for example, in Korea, but we're very, very conscious of the importance of working in our region. So thank you for the really important question, Deb.
Yeah, look, I think that's an excellent question, and you're right, it wasn't touched on, but we do work extensively across the Asia Pacific through I guess formal and informal ways. And so, for example, and I'll talk specifically at the Doherty Institute and at VIDRL, we host 3 WHO collaborating centers, one in influenza, one in viral hepatitis, the other one for MLSerans. But we also have regional reference laboratories for things like measles, polio, rubella, and through those networks we are continuously connected, if you like, to partners in the Western Pacific, but also the Asia Pacific as well. We run, I guess, a number of capacity building initiatives, again, across the Asia Pacific, and particularly in Papua New Guinea, and a number of other Australian institutes do that as well. And you're right, I mean, we're very cognizant that we shouldn't just think of this as a health security threat to Australia. It's actually, enabling our in-country partners to develop systems and processes of their own that they can therefore protect their own populations, but globally at large. So I think it's a critical point. I would say it's not perfect, and again, it needs and just go back to Jean-François' point about, it needs a top-down and a bottom-up approach, and cross-sectoral as well. We focus exclusively on helping our human health partners, but, look at the outbreak of, foot and mouth in Indonesia. There was a massive response that was required globally to assist Indonesia with that.
And in our last 30 seconds, I'll ask Rachael, do you have anything you'd like to add?
Well, I do think that we actually, so there's a couple of thoughts. One of them is that we actually did become quite insular, I think, over the last couple of years, and we actually we need to start becoming much more outward looking and really kind of concentrating back on those sorts of things. But I take your point around the skills development and the skills development globally, and that is something that we, again, have become quite insular. And Australia is, we are at risk of that, and we really, really need to be very cognizant of of that. That said, you know, there are really, we have the Global Health Equity Centre here at Swinburne, who are directly looking at actually how we can upskill people in, you know, end user centered design. So bottom up kind of approaches. And there are also things coming from the World Health Organization and have been really active very recently. And there's an organization called GATE, which is a Global Assistive Technology Alliance or something like that, which is actually looking at embedding those sorts of technologies right throughout here. And we have centres. So we are actually aware of it. We just haven't had in this 50 minutes, it hasn't been enough, but we are very, very aware of the skills development needed. And that's one of the other positives with the digital communication, that actually we can help to upskill people in different ways. And we're looking at that. We've just actually got a very small grant from the Victorian government, partly for a conference that we're running, partly to ensure that we can reach our Asia Pacific neighbours. So we are acutely aware of the skills gap that's there and needed.
Thank you. Look, I'm conscious of time, Paul, that we'll finish up, but I would invite people on Zoom to address their questions via email, perhaps to our presenters. Folks, thank you. This has been an amazing panel. I think we could have a whole symposium on this topic alone. I know we could sit here all day and just chat about this, but it's been brilliant. Thank you very much to all of our panel. Thank you too for the engaging questions and for joining us here today. Please join me in thanking everybody for their participation.